am going to welcome everyone again to our There Is No Health Without Mental Health webinar. Today we have two guest speakers. We have Dr. Kim Sundling, who's a board-certified psychiatric pharmacist with direct and indirect clinical care experience. She is the behavioral health clinical pharmacist at Florida Blue, and she's showing up in the top box. And then underneath you see Debbie Del Rosario, who's a licensed clinical social worker with 25 years of clinical experience in direct and managed care environments. And she is the director of behavioral health clinical programs at Florida Blue. So with that, ladies, I am going to turn the microphone over to you.
Awesome. Thank you so much, Patty. Well, I first want to say welcome. I am so happy that you guys are here to learn more about mental health, and just really, this is the way that we're going to change kind of people's thinking about what mental health is. And really, the biggest thing today is that we want you to learn about the connection between mental and physical health, because we say this a lot, but really there is no health without mental health. And sometimes mental health gets left behind, and hopefully today, as we discuss, then you can kind of learn more. And as we go, if you guys have questions, please type them in the Q&A, and Debbie and I will be answering them at the end of the presentation. But again, thank you for being here. I will be doing the first half of the presentation, and then Debbie will be taking over at the end. So the objectives today, I kind of talked a little bit about what we're going to be doing today, but kind of an overview is we're going to talk a little bit about mental well-being, this COVID-19 pandemic and its impact on not only mental health, physical health, and things like that, talk a little bit about stress, burnout, and then also really focus on the connection between chronic illnesses like diabetes and mental health and how they coincide. And then also just really figuring out how do we help people that struggle with both of these things, and what can we do, and what can you do if you are having symptoms and you need help. And we hope that we can answer those questions or these objectives for you by the end of this presentation. So first off, what is mental well-being? That is said or it's said a lot in this day and age, and it's something that we really care about in Florida Blue. And here's why. Because mental well-being is an overall positive and hopeful emotional state fueled by a sense of purpose and satisfaction with life, work, and relationships. It is supported by the capacity to adapt to life stressors. So that is a very kind of broad definition, but what actually impacts that? Because we have the definition, but what is actually driving that? What impacts it? So things like biological factors such as family history or changes in body chemistry. The body chemistry one, it can be things like having a baby and getting postpartum depression because of the drop of neurotransmitters or hormones. It can lead to the postpartum depression. And there's also medical conditions where the brain chemistry can actually lead to or mimic mental health conditions. And we'll talk about that here in the upcoming slide. So I want you to be aware of that. Other things that really impact mental well-being are going to be life experiences, such as trauma and loss. And I don't think anyone has not been impacted by the pandemic. I have been impacted by the pandemic, whether it's losing a loved one, maybe you lost your job, or just even having to adjust to having your children at home or having to work with your spouse. It can be a very big disruption, and some of it can be pretty traumatic for some people. And unfortunately, this is still going on. We are still in the process of recovering from this, and that's okay. Other things that can impact our mental well-being are typical day-to-day events that can just make us feel blue. And a lot of times people think, they try to figure out why are they feeling blue. And there can be legit causes, such as like maybe you just had a big test or you just had a wedding and you kind of have that crash I know when I was in college, after finals week, I was pretty much up all week. I would just crash and burn after that, and I would feel really blue. But sometimes there's days where we just feel blue, and that's totally okay. Like, that's just part of life. So those are kind of the main three things that we really think of when we think of things impacting mental well-being. And just so you know, mental well-being can really change over time. It can really depend on the place the person's in life. A person's age can really impact it, how you cope with things. I know for me, I handle stress a lot differently than my husband, and it's just because we're wired differently, and it doesn't mean that the way he handles stress or the way I handle stress is wrong. It's just we are two different people, and that is totally okay. And this probably is not a big no-brainer here, but the COVID-19 pandemic, it's impacted not only physical health, but also mental health. And sadly, the majority of employees say their job is the main source of their mental health challenges, and 65.9% reported a higher level of stress since the outbreak. And this could be from a variety of reasons, whether it's to adjusting to working from home or adjusting to having your spouse in the other room working as well, or having your kids home and interrupting you constantly. It can be from a variety of reasons, in addition to our healthcare community. The healthcare community is very burnt out. And I'm talking like pretty much all of them, but especially the frontline folks like in the ER, the ICU, primary care providers, and all of the frontline people. And I probably forgot to mention some, but those are the first that come to mind for me. And they are just burnt out because they are working at levels that their bodies are not meant to. When you do that for a very long time, we will talk about what can happen from that. It's called burnout, and I'm sure you guys have heard that. But we'll talk more about that in particular in about 2 slides. And really, the acute stress caused by the COVID-19 crisis has also triggered and even worsened mental health conditions, including insomnia, just substance abuse in general, has really increased significantly. Even in our younger population, it has increased quite a bit, unfortunately. Depression rates are higher. Just overall, the COVID-19 pandemic has impacted not just the physical conditions and the long-term effects of that, but it's also really impacted our mental health. So I think everyone has probably experienced stress in their life, and if you haven't, I am jealous of you. But stress is a physical and emotional reaction that we experience as we encounter changes in life. So there is the psychological perception of pressure. So just kind of like your mind is spinning, or you just really can't track your thoughts because they just feel like they're all over the place. And then the second thing is the body's response, which involves multiple systems, from the metabolic system to muscles to memory. And the driving thing behind that is actually mainly related to epinephrine and norepinephrine and dopamine. And all of these chemicals cause a reaction in your body. And on the next slide, we'll talk a little bit about some of the things that it can cause. But maybe you've experienced this, like, for instance, when I get really stressed, I know my endorphins really get going because my heart starts to race, I start to sweat, my hands get a little clammy, and sometimes my stomach gets really upset, and that's all related to stress. And it's because it's driving your adrenaline and things like that. So some people don't have that physical response, but I know a lot of people do have the physical response, and sometimes it can be mistaken for actual, like, physical conditions and things like that. But once you actually treat the stress, they often get better. So this is what I was alluding to earlier. How does stress actually impact your body, your mood, and your behavior? You can see here on this slide that there are a variety of things that stress can cause. And this is not even close to all of them. And I'm sure everyone on this presentation or this call has experienced one of these things or experienced something related to stress. So on our body, it can cause headaches, muscle tension, chest pain even. There's people that go to the emergency room for chest pain because they think they're having a heart attack, but it's actually sometimes a panic attack. It can change your sex drive. I already mentioned the stomach upset. That's definitely one for me. Related to mood, it can make you anxious, restless. On the extreme side, it can even cause sadness and depression. Other things that it can cause is just a lack of motivation and things like that. So there's a lot of different things on your mood, your body, and then on your behavior. It can really impact lots of different areas. But the ones that I kind of really think about are really going to substances, and it can be related to food. It could be going to alcohol or illicit substances or even tobacco. But on the flip side, it can cause us to be angry and exercise less. And you can probably guess that over time, these things are going to lead to chronic conditions or, a mental health condition. So these are just kind of good to know, and maybe you yourself have used some of these things to cope with stress. So I mentioned burnout earlier, and burnout is really a state of physical, mental, and emotional exhaustion. And this, unfortunately, is going on at a higher rate than we have seen in a very long time. And it's directly related to the COVID-19 pandemic. I'm sure some of you are experiencing this, have experienced it, or, continue to fight this battle. And a lot of it is related to different things. These up here are just some of the things that can cause it. It doesn't mean if, you aren't experiencing one of these things that you can't be burnt out. These are just some that I picked out, and I want to make that very apparent. So prolonged stress, which I kind of talked about on the previous slide. So prolonged stress is really going to be a huge driving factor in burnout. Poor self-care. So not eating, not exercising, not sleeping, especially not eating and only maybe eating junk food or not eating at all. There's some people that have the opposite effect. And then taking on more than one can handle. So if we think about the pandemic, you have a full-time job, and then you have to be a teacher to your kids. You have to try to balance learning how to work from home. Like this is why people are getting burnt out, because not only are you having to do your full-time job, but you're also having to take care of other people, or just the adjustment of being by yourself all day. Like for me, I'm by myself all day, which is a different adjustment for me because I was used to being around people. So there's a lot of different things. And then I kind of said this one when I just mentioned my situation is just the lack of social support with whether it's work, friends, family, things like that, because you just can't be around people that you normally are. So symptoms of burnout, and these are pretty similar to just feeling stressed, but these are a little bit more, advanced and things like that. So symptoms of burnout, you procrastinate, you just don't get your work done, chronic fatigue, pessimism, insomnia, headaches, and just really feeling hopeless. Depersonalization, what that means, it's kind of a fancy word, but basically what it means is you just are not like yourself. You just, like for me, I would not be the Kim that I normally am. So that's kind of what it means. Like if you're normally a goofy person and you're just not like that anymore, that's kind of what that depersonalization is referring to. So just like stress, burnout can lead to mental and physical symptoms and subsequent chronic illnesses. So you can see that these really can lead to some pretty long-term things if we don't take care of them. And sometimes, we think of stress like, oh, it's fine, I'll be fine. But really, over time, it can just really hurt your body. So that brings me to this slide. So chronic illness and mental health. What's the connection here? So chronic illness, first of all, is we typically think of it as something that does not resolve spontaneously or something that does not necessarily have a cure. So an example of a non-chronic illness would be something like a chest cold, pneumonia, a broken bone, things like that. Those are things that, you take your antibiotics, you get the cast, probably going to get better most of the time, unless you have complications and it goes on for longer than that. I understand that. But chronic illness is typically things like diabetes, hypertension, lupus, and things like that. So receiving that diagnosis can be extremely life-altering. It can kind of bring in a variety of emotions. Like I'll use diabetes, for instance. You have the risk of having to go on insulin, having to poke yourself 3 times a day, and that can be really overwhelming, especially if I were in that situation. I'm deathly afraid of needles and blood, so that would be very hard for me to stomach. Maybe not someone else, but really it is going to be something that you have for the rest of your life. Typically, yes, symptoms can get better, but it is going to really change your life going forward. So having a chronic health condition can make you more likely to have a mental health condition for, a variety of reasons. There's thoughts or hypotheses behind what the connection is, and up here are some of them. And I failed to mention this in the first part of this slide, but just so you guys know, chronic illnesses are the leading cause of death and disability in the United States. So if that alone should tell you, like, hey, this is pretty stressful, this causes a pretty big change in your life, that is why it often leads to these things, because, for one, there's chemical and hormonal changes, and it can be a wide variety of neurotransmitters, but when I think of mental health conditions, the kind of 4, I would say, chemicals that it's typically talking about are serotonin, dopamine, norepinephrine, and epinephrine. So kind of your adrenaline, and then serotonin is it's kind of your happy chemical, and then dopamine is your feel-good chemical. So dopamine is typically released like when you eat a really yummy brownie, or you go for a run, or have sex, or hang out with friends, or go see a movie. It's that chemical that really just is your feel-good. It's also your reward chemical. So there's other physical and chronic conditions that can impact those chemicals, and it can cause mental health conditions. Hospitalizations or reduced mobility resulting in isolation. So we kind of talked about with burnout, how lack of social support can cause kind of long-term burnout or lead to certain things. And, if you're hospitalized, or let's say you are kind of stuck in a wheelchair, or even just having to adjust to using a walker or a cane, you just can't get around as well, and it really limits you in what you can do. So like, for instance, for me, if I suddenly was not able to walk or run as well, I'm a really big runner, that would be a huge adjustment for me and really would just change my entire life. And I'm sure some of you probably have stories about things like that it just completely altered what you could do, and kind of you lost your identity when you lost that part of yourself. Other things that can kind of lead to the mental health issues are going to be the excessive worry about managing a chronic health condition. I'll go back to diabetes, but when you get diagnosed with diabetes, it's suddenly kind of like, oh my gosh, I need to change my diet. I need to make sure I'm checking my blood sugars. I need to make sure that I'm eating enough, otherwise my blood sugars get too low. So there's just all this worrying, and especially like long-term complications, like if, for instance, with diabetes, it can lead to blindness, it can lead to just lots of things. So just worrying about the long-term effects over time can lead to things like having an actual anxiety disorder, panic disorder, things like that. And then lastly, the other one here, just inflammation from long-term stress. There's some theories out there that by being stressed and for long term, it can lead to inflammation in the body. And over time, that can lead to just mental health conditions. There's a lot of research in that area. It's not as supported, but it's definitely something that I'm very interested in and definitely exploring more and more every day. So the next, I guess I should say my last slide before I let Debbie take over is really what are the chronic health conditions that have higher rates of scoring positive or are at risk for having mental health conditions. So up here, you've probably heard of most of these, but COPD is chronic obstructive pulmonary disease, and it really impacts your breathing. And one of the most common things that can occur when you have COPD, the most common mental health condition is actually related to anxiety or depression. More so anxiety because of the stress of not being able to breathe. It's very scary and uncomfortable. So there's very high rates of anxiety and chronic pain. And I know many of you probably struggle with chronic pain, and I have so much, I have sympathy for what you guys have to live through every single day. But with chronic pain, unfortunately, they have very high rates of mental health conditions. And it really is a wide variety of mental health conditions, but the more prominent one is definitely depression. And a lot of it is related to kind of what I was talking about earlier. If your life just gets completely flipped and you can't walk or you can't run as much or you can't get on the ground and wrestle your grandchildren because your back hurts so much. It just really changes everything. And in there as well, there is some thought that the chemicals that are signaling like, hey, I have pain, actually can also cause mental health conditions. So it's kind of a marriage of, is it actually related to the condition or is it related to the chemicals or, the actual having pain and having everything get adjusted. The other one that we really see that has high rates of depression is heart disease. And heart disease is a pretty broad term, but probably what some of you maybe know is if you've had a heart attack, that can be related to heart disease, heart failure, angina, coronary artery disease. That's what heart disease encompasses. But depression is very common after having a heart attack. I'm going to talk a little bit about heart attacks. But after you have a heart attack, it is extremely common to be depressed, whether it's from just the big change of having a heart attack or just because of the heart attack, like physically what it did to your body. And there's also medicine that you get after having a heart attack that can make you feel like you have signs and symptoms of depression. So it's a little bit complicated, but there are studies that if you've had a heart attack and you get treated with an antidepressant after having it, that they have better outcomes. So it's a little bit kind of more out there of what exactly is causing it, but I just think it's interesting from like a pharmacist standpoint on kind of that when you do treat after having a heart attack, that they're less likely to, one, have depression, but also have better outcomes. And then diabetes, I've been talking a lot about diabetes, but it's because diabetes is really common. I'm sure all of you know or have a loved one, or maybe you yourself have diabetes, but diabetes can cause a wide variety of mental health conditions. And one that is becoming a little bit more prevalent is actually eating disorders and anxiety. But with eating disorders, it's becoming more and more common in younger adults or teenagers that have type 1 diabetes and kind of, adjusting their insulin or not taking their insulin and things like that. So just something to be aware of if maybe you have a kid or know someone that has type 1 diabetes and they've been losing weight and things like that. It's just good to kind of be aware of that. And then the anxiety part of it with diabetes, kind of talked about that earlier, but a lot of it just comes from the worry of the long-term effects, worrying about having to manage everything. I know I would probably be pretty anxious about it, not just because I'm afraid of blood, but just there's a lot that comes with being diagnosed with diabetes. So just want to make that very clear. And then lastly, cancer. I mean, this one's pretty self-explanatory. Cancer just flips your life upside down. You maybe are unfortunately not in a non-curable situation. And as you can probably guess, depression is definitely the most common. But what I will say with cancer in particular, if you do not treat the mental health condition, you have worse outcomes, or patients have worse outcomes without treating the cancer or the mental health condition. So with that being said, I'm going to pass the torch over to Debbie.
Hi there. Thanks, Kim. As Kim was indicating, there's definitely a lot of effect of of the chronic diseases with mental health. And what we're really wanting to hopefully express to everybody is that when we're looking at providers, we're looking at individuals, we want to be looking for treatment for the whole person. It is not just a diagnosis. These are individuals not just with diabetes. There's other compounding components to that we definitely need to focus on, not just that specific illness and think that that's the only thing that is going on with the individuals. There are multiple components to it. Not only may a person have a physical condition, but they may be going through depression because their life has now been impacted. They may be going through other situations and other societal concerns, thinking about their economic society status impact. Have they gone through trauma? How does their race impact how they are looking at this condition, or how it imposes upon their thoughts? It's definitely important to think about that, when we're looking at treatment, when we're looking at our opportunity to work with individuals, that we're not just thinking of that physical condition, that we need to think about the whole person, as their mental thoughts are definitely going to impact how they are viewing this illness, thinking of how they're going to react to it, thinking how it's impacting their position in life, how it's impacting their family situations. And we really need to look at that next component that regarding other treatment, that we also need to think about how is this also impacting their mental health, because there's really no treatment of health without consideration of their mental health. When we're looking at individuals, it's also important to not think of just their mental capacity, but it's like, how are they going to address the adversity that they're going through? Each of us has within us the ability to adapt to what we are going through, and that's called resiliency. It's the process of adapting to the face of adversity, trauma, tragedy. We look at threats or how stress is going to impact us. And this stress, as we've said, not just from a physical component, or if it was a chronic condition, but it could just be from life itself. It could be from family situations, problem situations, as we've been talking about our serious health problems. With COVID, there's been impact from our workplace components, as it's shifted how our work looks on a day-to-day basis. Based on COVID, and if we are having financial stressors, that could be stemmed because we've lost our job, or it could be stemming from having to take care of those medical conditions. We really need to rely on how our resiliency, or how we're able to bounce through or bounce back from those hardships that we're going through. And the key is that we don't want to just coast by. We want to be able to survive. We want to be able to work through those components, because unfortunately stress doesn't slow down. It doesn't stop. It continues to go through, and we don't want to be crippled by the components is. I truly believe that, our thoughts impact how we address things. And if we can change our mind or change our thoughts, we can change our behaviors. And it can make a big difference on how we are handling things on a day-to-day basis. When we want to look at how can we build up our own resiliencies, we talked about a couple of them. I think the first one is social connections. We're social beings. Humans are social beings that we need to make sure that we're prioritizing or linking with relationships. That's why family, friends, co-workers are great ways of building value, of being able to build that connections and working with individuals. COVID has changed some of that a little bit, that where we may not be working right next to or talking to each other, maybe at the water cooler or talking to somebody in a cubicle next to us. So unfortunately, we do need to come up with new ideas of how we're going to interact or build up our relationships. Sometimes it's joining groups of like-minded individuals, finding groups online or clubs that you're interested to helping building those connections. So also building your social connectivities, maybe using such things as a digital self-management tool. We've talked about here or for Florida Blue, there are some digital tools as well as some that are out in the community that help build your knowledge of how to address when these things come towards you. What can you do to better prepare yourself for that? And those tools can give you educational opportunities in figuring out that right steps of how to handle stress when it does come knocking at your door. We talked about physical well-being, focus on positive lifestyles. I think it's ones that we've heard time and time again. You know, it's really important to stay healthy. You know, exercising, finding some movement. If you're not able to do a marathon, I am not. If we're able to move through, it's just moving about throughout the day, not staying stagnant. If it's sometimes difficult for even to get up out of bed, sometimes like, okay, well, just make a movement from maybe your bedroom to the living room. Making those small steps to keep moving forward, and you'll feel, feel better about your day. Sleep is critical. Making sure that you have 6 to 8 hours is normally the right equation that's been placed out there to make sure that you get that good quality sleep, so you'll be able to rest and relax at times to be able to address kind of those next steps coming towards you. It's important to also avoid negative outlets. That could be social media. It could be the news. There's, I know that unfortunately, we definitely need to be aware, be mindful of what's going on in the world, but maybe looking at maybe some of those outlets to not be the last thing you have before you go to sleep, or not looking at social media right before you go to sleep. Again, to kind of keep those last thoughts to be more on the positive side or the healthy thinking, as the next statement is indicated in there, to keep looking at things in a positive component. For healthy thinking, definitely think about practice mindfulness, taking a moment out of every day to quiet your mind, to be more focused, learning to manage maybe some negative thoughts. It's very easy, I think, and nowadays to place yourself down, to think negative about yourself. Self-image may be low. And like I said before, I think if you can change your thoughts and looking at things from a different perspective, that can make a big difference. I look at that we have all survived the worst days of our lives. We've already done that. We've accomplished so much, but we rarely give ourselves the credit for those components. We usually think of, oh, I can't handle this. I can't do that. Well, you've handled everything up until this point, and you're still here ready to tackle on those next steps. It may be hard to move forward. It may be too overwhelming, whatever those stress may be, but be able to take maybe a tiny step or just a small component, as it says, finding this purpose. Beginning those small components that you need to move forward in a direction is just a step, and you keep moving in that right direction, so continue to do those. When we're also thinking about finding things in perspective, I always find time to look at things from a gratitude component. I look and see if there is one thing I could be grateful for. I think we can all find at least more than one, but sometimes when you are going through a lot right now, a lot of stress, sometimes shifting your mind to think about things in a more positive component can make a difference. Think about things from a positive. Were you able to get up this morning? Is the sun shining? Do you have a roof over your head? Do you have food? It might not be something you might want to eat, but you have food in your fridge. You have people that care about you. Those little things that make a difference in our lives, and it again helps lead to that positive thoughts that we have. And finding a purpose, as we were talking about in the beginning of a definition about a positive well-being, is finding satisfaction in your life. What could that look like? It could be looking at volunteering or helping others, setting maybe a better you goal. It could be finding something that you're wanting to learn, something you want to do different. And then as you make these goals and make these decisions, make those small steps of towards those components. Again, you don't have to accomplish everything in one particular day. Taking small steps every day just gets you closer and closer to the goal that you're looking for. Sometimes we can't get through just by thinking positive thoughts. Sometimes we do need to seek professional help, and that is okay. That is what it's there for. if we're seeking professional help, one of the things that we definitely need to look for is that if you've been spiraling, we've mentioned that sometimes we all have a bad day. We all have some times where things are not going positive. But if you're able to move forward and then day after that or 3 days later you're able to get through it, that's fine. But if they seem to keep spiraling down and you feel overwhelmed for things that may be a contributive and you might be feeling it, it might be time to ask somebody for help. So if you've been feeling such things as, maybe difficult sleeping, maybe you're oversleeping 12 hours, just not wanting to even get out of the day and deal with what was going on, or the opposite. It could be your anxiety is so high that you cannot sleep at all and you're tossing and turning all night. As we mentioned before, sleeping is an important part, but if you're having difficulty, that's a definite symptom to be mindful of. If your appetite changes, where that results in an unwanted weight gain, so that could be, the two extremes. If your appetite changes where you no longer want to eat and you're rapidly decreasing or losing weight, that might be needing to talk to somebody. Or the other extreme where you're eating to overcome the stress or what's going on and you are feeling that you're getting an unwanted weight gain and not able to stop eating, maybe it's time to start talking to somebody. We mentioned about struggling to get out of bed in the morning because of how you're feeling, that you feel lack of motivation, lack of being able to, not concentrating, if you're not able to move forward because you feel so unhappy about the day. It's definitely time to talk to somebody. Loss of interest in things you usually find enjoyable, or the inability just to perform the usually day-to-day functions. If it has become so overwhelming to do the dishes, or again, you want to eat but don't have the energy to cook, looking at those things to see, is there time to talk to somebody? And you're not alone. There are many of people who are out there who are interested in wanting to help you along on that journey. You can talk to your primary care doctor about you or your family if either of them are identifying with these symptoms. And they are there to talk about, again, not just your physical health, but your overall mental well-being. They are interested in wanting to know about how your health is going. Your mental health can impact how you are dealing with physically, so they want to know. So they are there to help out with that. There's opportunities for finding a therapist if there is a behavioral health therapist that you're interested in talking to so you can either help process or just to help understand what these thoughts or feelings are going through. And they can give some recommendations of how to either identify triggers that may be impacting these thoughts or feelings, or they may be looking at opportunities of how you can help overcome them when you are faced with them throughout your life. We've talked about joining support groups before, but they are there for each other. It's sometimes easy to think that you're the only one dealing with that no one else could understand, but sadly, we're not alone. There are a number of individuals who are going through these same situations, who are going through the depression. They're going through physical situations. They're going through grief, loss, struggling with substance use, all these components. And there's individuals who are wanting to help each other to get through those processes. And there's opportunities to find those support groups out there. If things are so overwhelming, if you are at the point of crisis where it just feels like the weight of the world is on you and you have thoughts of harm to yourself or thoughts of attempting suicide, don't wait. Please let somebody know right away. Dial 911 if indicated for emergency services. There is a National Suicide Prevention Lifeline that's indicated there on the slide for the 1-800-273-TALK. There's also a crisis text line. These numbers are available 24 hours a day, 7 days a week. Even here in July, just to make things simpler, the United States is switching to an expanded suicide hotline number. So just like there is a 911 for emergencies, there will be a 3-digit number, 988, which will be specifically for substance use for suicide hotlines, and they're there to help those individuals who want or need some assistance. If there is other general resources that you're needing, maybe national or local resources that can help, we are able to provide some resources through our Florida Blue Care Partner, New Directions. They have a number of community resources So if there's components that you're looking for national or local services to help with your mental well-being, maybe some education is sometimes indicated. So sites such as NIMI or NAMI is also available. So neither one of those, National Institute of Mental Health or the National Alliance on Mental Illness, both have great resources and educational information that talks about things such as diagnosis, signs and symptoms, recommendations of treatments if you are identifying any concerns or have any thoughts about concerns for a loved one that may need some assistance. So there could be education about or information related to kids, teenagers, young adults, what to look for if there is concerns about their mental status, if there's concerns about taking care of somebody with a mental illness, individuals with veterans or active duties, and multiple components. If you're looking for a community resources, there's also United Way, which 211, we love those three-digit numbers. Those are always great to remember when looking for confidential resources or referrals in your community. United Way themselves help with food, housing, employment. They do have linkage to identify maybe some counseling service or some support groups that you're looking for. So it's simply just calling 211 and anywhere in the United States, and they will help with those connectivity of that. I think the biggest thing, hopefully Kim and I are hopefully expressing to everybody, is to be patient. Take things week by week, day by day. Be kind to yourself. Realize that you're not alone. The things that you can do are sometimes those self-care components that are easy to understand, which is taking care of yourself, taking care of what you need. And if you need resources or connections, don't be afraid to ask. And that concludes our presentation.
Perfect. Well, thank you very much, ladies. And I wanted to tell everyone at the end of the webinar, if you'd take a moment to fill out our survey, that would be great. But let's get to the questions. First person was asking about cognitive behavior theory, and I think really about cognitive behavior therapy, if that should be for a limited period of time, or should that be ongoing? Like, how long should you be doing something like that?
Yeah, I'll take that one, Kim. Cognitive behavioral therapy is traditionally using, again, your mind and your thoughts on how to work through situations. There is no guarantee saying that if you do X amount of therapy, you will get end results. Each is dependent on the individual person, what the situations they are going through, and working to that component. So the best recommendation is as you're working with or talking with your therapist, and if they are using cognitive behavioral therapy, asking them about the progress. And if you're looking to feel like you're not making any changes or any movement, asking, saying, what goals should I be looking for? What signs of success proves that I'm kind of heading in the right direction? Because it can be defeating. It can be hard to think that, well, I have 100 or I have a number of situations going through. What can I do to get through it? And just walking through it step by step. But usually cognitive behavioral therapy is taking each situation, kind of breaking it down of components and seeing how to walk through those processes. So I would recommend talking with your therapist as you're walking through it to make sure you feel like you are moving in the right direction.
Okay. How long does burnout normally last? Is it a long-term effect of stress, or is it something that happens to you in the short term?
It tends, well, you go ahead, Debbie.
Oh, yeah. I was about to say, it really depends on the person, first of all. I mean, every person is different, and sometimes burnout can be a multiple thing. I know that I could be burnt out from a day of work due to whatever had happened that day. But if I get time to catch up or to maybe some self-care components, maybe get time to be in front of the TV or relax or, kind of overcome my exhaustion, whatever that had looked like, you may be able to get through that. Many a times people who are going through things such as maybe caregiving, or if they're dealing with chronic illness, they don't get a chance to kind of catch their breath from those components. So sometimes they can feel a little bit longer. Tim, what would you say?
Well, pretty much what you said, that it's very person-specific, but also know that in some people it can last years. And that's totally normal, especially like what Debbie was saying. If your circumstances don't change, you're going to continue to be burnt out, unfortunately.
Okay. We got a second burnout question. As someone said, how long does it typically take to get past it? I know it depends on the person, but generally, how long can one expect to go through the recovery process? It's been over a year in, and I'm still struggling, and I'd like to know if that's normal.
A long time is a year to me is a long time. It might be time to talk to somebody else about that component, because I'm not sure of the situations, but if the burnout is due to something that is still going on, you haven't had a chance, like I said, to catch your breath. You haven't been able to find a moment of peace during that time because you're still potentially dealing with that component at that same time. So it may require talking to somebody and finding ways of finding that opportunity maybe to move, to find ways of rejuvenating or reconnecting with things. Because burnout, again, is when I think of it as a candle, when you're kind of burning both ends and you're not able to kind of catch your breath. How are you going to be able to build that candle back up? Because is it finding a small hobby that maybe brings you joy? Is it finding opportunity to like watch TV? Is it finding exercising, something like that may be needed to help get through step by step to get through that burnout?
Gotcha. Okay.
And also, I would just also comment and echo what Debbie said. Definitely, make sure you're talking to a professional, because you very well could have depression. Burnout and depression can kind of look alike, but it might be at a point where you need therapy or even medication, and that's totally okay. You're not weak if you need those things. It's just, if you're not getting better, there's something still going on that needs to be changed.
Okay. Question, Kim, you were talking a little bit about some of those health conditions that put you
Yep.
more at risk for depression. And we got a question for someone who has COPD, can that affect one's short-term memory?
Yes, and it's typically related to oxygen. So COPD, what it does is you have all these like blood vessels in your lungs and where the oxygen comes in, and I won't give too big of an anatomy lesson, but essentially what happens is instead of your vessel being like this, it's like this. So you can imagine that it's really hard for oxygen to get through there. So if you're not getting oxygen to your brain, you're not going to be able to think as well. So it can not only affect short-term memory, it can just be in general, your thinking can be a little bit impaired. And really your best bet on helping with that is making sure you're very compliant with your medications and following the instructions from your provider. But yes, you are correct. It can definitely affect your memory.
Okay. If you've never been diagnosed with depression, but you know you have symptoms of it, and you tried to hurt yourself a long time ago, and you're just holding everything inside, what do you recommend?
I think talking to somebody. There have been not knowing the full situation. You may not have been diagnosed with depression, but there's obviously things that you've seen within yourself that shows that you did have concerns. If you had thoughts about hurting yourself, there was a moment where you lost hope. And even though that we are there, that luckily that was not successful. You're still here with us today, and you're holding it together in a sense, in a way you're not as well. And talking to a professional is just a way of stretching out a hand, and they're there to help you through that process. So I think it would be very helpful. Hopefully we'll go out and talk to a therapist and know that they're there to support you. They're there to help you get through that and helping you continue to build with those strengths that you have that helped you last time for not being successful and getting you through these next concerns that you have.
Okay. Question about, well, this is a couple of questions, so I'll read them all. Are primary care physicians trained to treat mental health issues? How should we ask them for support if we need it? is mental health treatment covered under health plans? And do we need a primary care physician referral to be able to get treatment?
That's a lot of questions. Let me go through.
I know.
Through though. So I'll start with the easy one. Do you need a primary care referral to get treatment? Nope. That one's easy. if you need treatment, please definitely go and talk to a provider for that services. So that one's a great one to talk about. Mental health is covered under the health plans. That is a covered benefit. When you're talking about our primary care doctors, their level of expertise is just as similar as everything else. There are some that are well-versed on mental health and how to treat it. Some of them know just the basics, that they know that they are aware of it. I know that's an educational opportunity that we are working with a number of our primary care providers to making sure to ask that question. I think a lot of the providers, or especially the ones that I've been talking with, are versed. They are asking the questions. They are asking at least depression questions. Is one that I know has been consistently been evident in the ones, especially that I have talked with. And the intent is what we were hoping for is that they will ask these questions. How is your interest? Have you seen any change in your mood? Anything along those lines to help realize what's that next step where you're going to be. And again, we've looked at the opportunity to educate these providers to make sure they know either to connect with maybe a provider they're already aware of. Some of our primary care providers actually have a therapist in their office because that's what they are also committed to have in place, or they'll maybe give a name if they know of any recommendations in the community. But you don't need a referral.
Right. And something that just came in from someone too, because this webinar was open to the community along with, our group. So we don't know necessarily who has, what coverage.
Oh, that's true.
Right. But they were just basically saying that a lot of us have employer assistance programs. Like Florida Blue has New Directions Behavioral Health, and so sometimes you can get some assistance if your company has an employee assistance program too. That might be a place to start. Okay. So let's see. So I know Debbie, you touched on the 988 number that you said it's going to be by July. So someone was just asking, are we all going to receive notifications? Do you think it will be publicized nationally when that number is operational?
Yes, I know that has been a big push. I think this has been in the works several years that they've been looking to having this component, and it's taken a little bit of while because some states, 988 was their area code, so it took some changes across the United States to shift those components. But otherwise, yes, that is the intent. That is the movement here in the United States. They are moving towards to have that publicized, and that 988 will be operationalized.
Okay. My father has prostate cancer that went into his bones, and he's home with leg pain, and he's depressed, but he walks around as much as he can. What can I do to make him feel less depressed?
Debbie, you want to go first?
Yeah, I think, it's, I think talking to him is one of the first steps to talk about that, we all think he must be depressed because of X, or he must be depressed because of Y, when it may be something completely different. He may be sad because of the condition. He may be sad because he's not able to drive. It may be a multiple things. To find out what his concerns are, talking to him about it, not being afraid to ask the questions, I think is sometimes step one, just to seeing how he's doing. And sometimes it's asking every other day or every day, how are you feeling today? How can I help you get through this? And again, being there with what they need, I think is more critical. So if they are a type of person that likes to talk things out, being available for that. If they are an individual who prefers to just remain in silence, but having you sit next to them, that may be the difference to help get them through it. Yeah.
Okay.
Yeah. The only thing I would maybe add is that in cancer in particular, especially with the pain and stuff like that, it's unbearable. So I would make sure with his provider, whether it's primary care provider or the oncologist, make sure his pain is under control. And actually, interestingly, there's a lot of antidepressants that we actually use to treat neuropathic pain that could help with both mood and pain. So just something to consider. Obviously, you need to talk about that with his doctor, but that is sometimes what we'll do if someone is experiencing depression and pain. There's medications available that can help with both. So just something to consider.
Okay. If you work with an employee that has anxiety, how would you recommend critiquing their work without disrupting their mental health?
I think when working with anybody, it doesn't matter if they have mental health impact or anything, is that if you go and you are talking to somebody and you're going from a positive place, if you're coming from a place of positive intent, you're there to help them out. And that's the direction I would go through. Obviously, you're not there to belittle. You're not there to make them feel less than, but just going in there saying, hey, we are seeing that these are some current issues that has been identified. Just being, that, say, for example, they are not able to make some calls that they were supposed to be making. And if you talked about them, I know that these are the calls that you need to make. What's going on? How can I help you get through this process? Might be a good way of looking at it.
How can we do a better job of providing social support to our teams and coworkers now that many are in a permanently virtual environment?
There's a lot that can be done virtually, yeah.
I think one of the bigger things, like for me, I'm actually based in the Twin Cities or Minneapolis, Minnesota. So one of the things that is really important for me is seeing people on video. And I know it might seem silly to be on video, or maybe you don't have makeup on or stuff like that. But for someone like me, that just really helps me see facial expressions and actually feel like I'm in the room with someone as opposed to just talking to the picture. So that's definitely something that I would encourage you guys to do. Obviously, there's days where we don't want to be on camera, and that's totally okay. But that's definitely something as someone that works remote full time that I really appreciate from my coworkers. Debbie?
Yeah, the same thing. Yeah, when prior to even working at Florida Blue, I was in an organization that for 2 years worked with individuals in, different states. And the way that we build those connectivities is, you used to sit around a, pizza party, or you would sit around some food. Sometimes it's just shifting that mindset that now we're going to do it virtually, that we're going to collectively be on camera and we're going to get lunch delivered and we're all going to just tell stories or talk about it. It may not seem as organic as, walking by somebody's desk, but I think if you're mindful about those opportunities to connecting and wanting to be there, that can make a difference. Or just sometimes a chat, saying, hey, how was everybody's weekend? Just making those mindful decisions or outreaches.
Okay. Kim touched on postpartum depression. How long does postpartum depression typically last without treatment?
That's a great question. Thank you for asking that. I know many women actually suffer from this, and it's not often talked about. People always think it's just the baby blues, but it's not. There's actually 1 in 7 women actually suffer from postpartum depression. So I just want to level it out that it is something that happens pretty commonly in women. And unfortunately, if you don't treat it, it can go on for months, and it can even go into just major depressive disorder too. So I would highly encourage you to get professional help if you're not already, and you don't have to get on medication if you don't want to. So I know there's things that it can go in breast milk and stuff like that. And really, therapy is just as good as the medication. The combo is the best, but therapy sometimes can help depending on severity. But yeah, untreated, it can last months, and unfortunately, that can subsequently harm the baby in some moms. Not all cases, but some. So
okay. Well, everyone, it's 2:00. We're out of time. We didn't get to all the questions, so I'll put the ones we didn't get to together to Kim and Debbie so that they can work on answers for them. And if you would take a moment, we've got a 4-question survey over on the left, and I will do a follow-up email tomorrow with the recording link. and with the handouts that we have. And the next webinar that we're doing with the behavioral health team is on post-traumatic stress disorder, resilience, and post-pandemic growth, and that will be on June 16th. So Kim and Debbie, thank you so much for your time today and for facilitating this webinar, and I hope everyone has a wonderful rest of their day.